Um, Thanks a lot for the invitation, and indeed I'm going to shift gears a little bit. I'm going to work on modeling. When discussing the topic of my presentation, the first idea that came to mind is to tell you a little bit more about the ESCAPE project that we're working on, also with, for instance, Vittoria Kolitsa here in the audience and other teams. But then the question came forward that maybe it's good to talk about one specific approach as such, and I've chosen the next generation approach simply because I like it, but it's a bit of a challenge to communicate it because it's kind of involved, let's say. But it answers a few questions that were raised this morning, or potentially it adds to our understanding of a few questions that were raised this morning. So let me try to explain very briefly what the background is without going into too much mathematical detail. Then I'll talk a bit more about some early results that we also monitored during the pandemic in Belgium and in other countries. And then the longitudinal analysis looking at the Belgian pandemic as such. And one question that we were very much interested in was what the role of children was in this pandemic, a heavily debated question, a lot of pointing fingers, almost no discussion with the children themselves, and so on and so on. I can go on about that for a very long time. And then some future work, because it's not the end. This is really kind of a version in between. I'd love to have feedback from the audience as well. So we know COVID-19 pandemic, there were a lot of sources of heterogeneity that were really critical in this pandemic as such. But I think we can all agree that age is the key component here. So age-related heterogeneity had a big impact on the course and on the impact itself of the COVID-19 pandemic. And the idea here is to explore and understand the role of different age groups in virus transmission. On the left-hand side, you see the paper by Nick Davies and colleagues that already addressed the age-related heterogeneity, both from the epidemiological side as well as from the behavioral side. And on the right-hand side, you can see a picture of a compartmental model. This is the first version of the compartmental model that we used in Belgium. And the first version, meaning that there were several versions after, simply because we had to take into account the fact that, of course, this was not an immunizing infection. There was vaccination involved, there were variants involved, and so on. So this compartmental model was kind of quadrupled all over the course of the pandemic as such to do all of that. And within this, maybe just on the compartmental model, I'll go back to this a bit later as well. We need to distinguish between disease states, which we would call D states in the next generation approach, and states in terms that express heterogeneity with respect to age, sex, and so on. So this is kind of terminology that is well known for next generation, in the next generation approach. And the technique as such is not that novel as such. It's okay, it's not very old, but it dates back to the work of Caswell in 2000, looking at matrix population models. It dates back also to the work of Jaakko Wallinga, looking at the social contact hypothesis, where you actually express transmission rates for respiratory pathogens as being proportional to rates of making social contact. And these rates of social contact can then be questioned with social contact surveys. And the well-known example is the Polymod example, the first large-scale European study. And in the sequel of that, during the pandemic, we also collected within EpiPose, which is the predecessor in terms of European grants. During the pandemic, we collected data under the umbrella of the COMICS studies led by John Edmonds. In 2010, Jaakko also published a paper with several colleagues in PNAS, looking at optimizing targeted interventions and relating the effect of vaccination, which is expressed here as a derivative of the basic reproduction number, to, for instance, incidence and force of infection as such. And this will come back in just a moment. And then if you want to know much more about the theory and what it's all about, then we can refer to the book by Diekman and colleagues, where we look at the infected subsystem of this compartmental model that we've came up with, let's say, We look at the transmission matrix, a transition matrix, and without introducing these all in detail, the thing that you can think about is that these type of systems can actually be translated into what we call a next generation matrix, which means that we move from continuous time to a discrete time perspective. We're going to look at what if we know the situation today, can we then tell what will happen tomorrow? That's actually what we're doing. And the basic reproduction number is then nothing more than a dominant eigenvalue of this next generation matrix as such. So what are the elements of the next generation matrix if you want to interpret them? It's actually the elements Kij. It's the expected number of new infections of Hi caused by one infected individuals of Hj during its infectious period. And as I indicated already, the basic reproduction number is the dominant eigenvalue of this matrix. And of course, well, I have to tell you, maybe that's not clear yet, but we're working in a deterministic framework. So that means we have the threshold condition, basic reproduction larger than 1, we have invasion, and if it's lower than 1, we have no outbreak, or we're moving to the disease-free equilibrium as such. How do we feed this next generation matrix? We use social contact data, so we rely on the social contact hypothesis. The only difference is that this proportionality factor Q that is often used to relate social contact rates basically to transmission rates is not kept constant, it's age dependent, and I'll come back to that in a moment. We're also going to look at the susceptible population, the age-specific susceptible population. This is something that we need to have, and that's sometimes not so easy to get. You need serological surveys for that. Even serological data is not perfect for COVID-19, so that's also something we know. Or you need to rely on a compartmental model and the inferred susceptibility profiles that you can derive from there. In this sense, the next generation approach is actually a companion of a compartmental model analysis as such. Sigma is basically so your transmission rates. They include epidemiological parameters like infectiousness, infectious period, and also transition terms. And then this Q is merely a scaling factor here. And I won't go into detail too much about the scaling factor, but actually, if you know the basic reproduction number, and for most countries, we do have an estimate from the early start, or you know your effective reproduction number, you can actually infer Q quite quickly, quite easily. One thing I have to note here is that this next generation matrix in principle, or this next generation approach in principle, was first used especially in the situation where we are in disease-free equilibrium. So this is something that we have to cope with because we're monitoring what happens during a pandemic. Of course, we have immunity in the population, so we're not in a disease-free equilibrium. But that's something we can actually cope with in the sense, and there's a quick fix, let's say, that we're going to look at the effective susceptible population rather than the whole population, assuming that to be susceptible as such. Now, if you can do that, you can actually rely on the theory that has already been derived. Some of the concepts are already very well known. So the basic reproduction number, again, this dominant eigenvalue. The effective reproduction number, for that, you need to take into account the age-specific susceptibility. You can also look at left and right eigenvectors, and they have a specific meaning in this context. And that's the beauty of the heavy mathematics, maybe, the linear algebra that is there. But next to that, there is also the interpretation, the epidemiological interpretation. And that's the tricky bit about the methodology. This is something that if people are not really familiar with what's behind the approach, that you need to try to translate and to actually convey. So the epidemiological interpretation of the left and right eigenvector is actually the age-specific force of infection and the relative incidence as such. And these are things that we do know better, let's say, than just left and right eigenvectors. And this is based on a theorem, but I will not discuss that today. So the next generation matrix, again, it's really there to link the study of disease transmission with the study of variation of matrix components. And that's the key element that I want to get across. It defines a functional relationship between our effective reproduction number and these KIJs. And we can actually start to perturb this. And by perturbing this, what we're going to do is we're going to do a formal sensitivity analysis on which age groups have most impact on transmission, for instance. So you can actually ask yourself a few questions. What if a specific group undergoes behavioral changes because you are actually implementing non-pharmaceutical interventions? You're restricting social activities for certain age groups. What is the age-specific effect of social distancing? Which group is contributing or would contribute most to transmission? And that's not to point fingers, but that's, of course, more to act upon what is happening and to see how we can act in a smart way. On the left-hand side here in this picture, you see the mathematical quantities. I'm not going to go into detail too much about those. On the right-hand side, you see the epidemiological interpretation. So very briefly, on the top left, the sensitivity, that actually relates to the incidence and the force of infection. And this has been well established by the work of Jaco Wallinga in 2010. Then you have what is called cumulative sensitivity, and cumulative sensitivity is actually those age groups with a high per infected efficiency in generating secondary cases. That means really, if you start to perturb things there, that could really have an impact on your reproduction number as such. The cumulative elasticity is actually trying to quantify which are the groups that contribute most to transmission. And that's not necessarily the group that you need to intervene on, because maybe that's not the most sensitive group. So you need to actually work with cumulative sensitivity together with cumulative elasticity altogether. And I'll come back to that in just a moment. And then you have the reproductive or the infective value, which actually highlights the perceptible force of infection, where that one is higher, and so where new infections would weigh in on the evolution of the pandemic as such. So I know this is a lot to take in, but let me make that a bit more precise and more clear with examples. Just to be complete, we also introduced new indicators as such. I'm not going to dwell on these too long, but a lower level sensitivity, that would mean what if you would vaccinate a big group of people, 100,000 people at a certain point in the pandemic. Well, actually, this picture on the right-hand side shows you, depending on the moment you do that in the pandemic, there is a different outcome. And for instance, in this picture, completely to the right, you see the return to school in September 2021. Children were not the main drivers there, and I'll come back to that in just a moment. But if you would have vaccinated them, you could actually have a big impact on the reproduction number there. There was a lot of discussion about vaccinating children, yes or no, and it was much more, at times at least, an emotional debate rather than a very scientific debate, if you ask me. But maybe I'm a bit biased there. Then we also introduced, in the work of Constantino Catano, we introduced a relative impact index, because so far we've been looking at the impact on perturbing the cells of the matrix, but of course you also have secondary effects. So if you do a non-pharmaceutical intervention, social distancing for one age group, this has an impact on other age groups as well. So you need to take that into account as well. And so that is something that we developed and Constantino worked on, and we came up like with the matrix below, expressing, for instance, that in the group of 30 to 39-year-olds, you have a direct effect of a 17% reduction, but an indirect effect of a certain intervention of 4 to 6%. And then, of course, you can weigh in on the possibilities to reduce infection in specific age categories. So let me now explain a little bit more about this longitudinal study that we've done for the Belgian situation. We have 35 consecutive collections of the COMEX study in Belgium from November 2020 to March 2022. We started earlier, but then we did not have funding anymore. This brings us back to the data issue and so on. So basically, we had to beg for some funding. We finally got some funding again to get going again, and that actually delivered quite useful insights, I would say. On the right-hand side, you see a visualization of this COMEX study, and the number of daily contacts people make over time, and you see there's quite some fluctuation, especially in young age groups, and that has to do, of course, with schools as such. For the other age groups, that is not so clear, but there are subtle differences there that you can actually look at in more detail. The black curve, which you see over here, that is the effective reproduction number estimated on incidence data. And you see this area over here, and that's the Easter pause. That was a pause that was actually initiated in Belgium to prolong the Easter holiday, because at that moment in time we saw a surge in hospitalizations as such. And that really helped. And this analysis also shows that that really helped to break the chain of transmission as such. I already indicated that we need data on susceptibility and so on. I'm not going to go into detail now, but that's one of the caveats of the work as such, or of the approach. You really need to have an idea about what is the susceptible population. And actually, if we do exercises now, for instance, with ECDC, we still need that information. That is really crucial information to know what's going to happen next. So that is just a shout out to collect more serological surveys, as well as, of course, not to take them for granted, and to really think about what the serology tells you about susceptibility, because it's not a one-on-one relationship. I want to move to the insights here. The picture on the left-hand side is the elasticity. So this effective reproduction number that you see, that's the dashed line over there. Sorry, the solid line, and then you also have the stringency index here. That's the dashed line or the dotted line. And then you have these different colors, and it's a very messy picture. On the right-hand side, you see three groups identified from that picture. So children on the top, adults in the middle, and elderly at the bottom. And for each of these evolutions, there is something to say. Okay, but what I will do now, I will actually focus on some instances. In this picture, I will take snapshots at different moments in time. And on the previous picture, you see this indicated at figure 4 until figure 7 as such. And these correspond to specific periods where specific NPIs were in place, whether or not there was vaccination and so on. And this is kind of a useful way, or at least we believe this is a useful way to present this. And this is actually presenting elasticity over sensitivity. And what you see on the top left is what we call incidental. This is significant transmission, but there is a lower per capita impact on RT. So if you perturb things there, things are not going to change very drastically. Okay, but there is a huge contribution of groups that land in that quadrant as such. On the top right, you have the main drivers, actually. Those are the people that have a big contribution, but at the same time, if you perturb things there, so you release NPIs and so on, you can expect a surge actually to occur. On the bottom left is the marginal group as such, in the sense that they have a low elasticity and a low sensitivity, so basically they're on safe grounds, so to speak. And on the bottom right, you have a large sensitivity, but this group is not really contributing to the basic reproduction number as such, so no intervention is really necessary there. It's really the top right one that is really very important, and of course the shift from incidental to main is also the one that we're very much interested in. This was the situation in January 2021, and you see that in the incidental group, we have the 0 to 12-year-olds, and this is with the reopening of schools just after the new year. So we knew, and we also noticed that in incidence data in Belgium, that there was something going on as such, but that it was not too bad, let's say. But what we identified at that moment, that the main drivers were actually those aged 18 to 30 years of age. So, and that's very useful, because you can then intervene on that group and not necessarily on the 0 to 12. You can have your discussions better informed, and this will actually lead to better and richer discussions as such. Then we will move to March 2021 at the bottom in the middle. And there you see that the 0 to 12 are shifting a little bit to the main category. and that the 18 to 13 have shifted a little bit to the bottom as such. One thing that is difficult about these graphs is that these are relative graphs. So you always need to interpret them attached to the basic reproduction number. And here you see the basic reproduction, the effective reproduction number. And here you see the effective reproduction number is 1.04. So it's not a very worrying situation as such, but at the same time, it's good to monitor things quite closely. And a little bit after that, after this, we actually saw the reproduction number climbing. And that you see on the right-hand side, the 18th of March 2021, where we actually saw this 18 to 30-year-old group becoming more important, but also 40 to 50 becoming more important as such. And at the same time, at that moment, we saw a surge in hospitalizations. And that's not completely a surprise if you look at the picture here. Then this Easter pause was initiated. And then there was the school comeback, actually. And then you see 0 to 12 years shifting again to the right, but with a reproduction number lower than 0.9. So actually nothing to worry about in the sense that it's contained. And if you really take the reproduction number lower than 1 as the situation that is desirable as such, then this is fine as such. If we then move to June, we also see there that the impact of 0 to 12-year-olds diminishes as such. And the reason for that is because the summer holiday is approaching. Schools are actually having these days off and so on, exams. So the pressure is lowering on this young age group as such in terms of transmission, possible transmission events. And what is striking to some extent is 12 to 18 is popping up a little bit. Yeah. And if you move to the right, then to September, then there are 2 effects that come along quite nicely together, I would say, and that actually pushes back this group of 12 to 18. And that's one, that vaccination was actually offered to that group, as well as a summer holiday where contacts are reduced for teenagers especially, and that's something we already know. So I think this is quite useful to look at snapshots and to see what is happening at which time. And this actually, in supplement to a compartmental model where you would have to do a lot of scenario analysis, okay, a lot of scenario analysis, this is actually giving you the same information just by looking at one plot as such, or a sequence of plots altogether. So in summary, I think with this tool, and yes, it needs further development, but there are several groups now working together on making this a little bit more tangible, because that's the challenge, I think, here, is that children aged 0 to 12 are effective transmissions, but they were only key drivers at certain moments during the pandemic. And if you think a little bit more intuitively about it, it's kind of logical because they were not vaccinated, or there was no recommendation for them to be vaccinated. Some of them were, but the majority was not. So in that sense, from an epidemiological point of view, that's a key take-home message that maybe in hindsight, this was the better choice to make. But of course, there are other factors that you need to take into account. The group aged 12 to 18, we've seen just a snapshot of that, but there was a marked response to vaccination after Easter elasticity increases. So the Easter holiday, this pause, that was really quite effective. I haven't shown you what happened with adults and so on, but I can tell you, or I haven't discussed that at length, but we've seen that adults below the age of 50 years had a slower response to vaccination, and that adults aged 40 to 50 were the main transmitters after Easter, and due to, amongst other things, a moderate response to vaccination. And then finally, the adults above 50 years of age, people with more and more with comorbidities and so on, these were actually marginal contributors as such, so transmitters. There is somewhat a remarkable response to vaccination of the group 50 to 60. I haven't gone into detail there, but it really opens up an avenue of other questions that we need to pose ourselves in terms of compliance and getting vaccinated and so on. There are some issues, of course, here. One of the issues is that it collates a lot of information, this tool as such. It is fast. You can run it very quickly. That's not a problem, really. And you can actually use it to support or the identification of high impact groups for targeted interventions. And of course, the debate is then which intervention to take. So that's something that we're not claiming for this or that intervention as such. And there is a list of why not. It's an important list. It's an approximate method because you're always looking at one moment in time with the effective susceptible population at that moment in time. There are no mid or long-term forecasts, and that's something you really need from a compartmental model, for instance, at least qualitatively, not quantitatively, as some politicians actually have used during the pandemic in Belgium. It's a deterministic approach, so that's also something to work on. There is a lot of uncertainty still, so that's something that's still on the table. And it's highly dependent on the available data, but I think that's kind of the no-brainer with all the modeling tools as such. There is some future work, but in the interest of time, I'll leave that and just on the screen maybe, and I'll stop here and thank you for your attention.